Istvan Petak, Founder and Chief Scientific Officer of Genomate Health USA. Thanks for being here today.
Thank you so much. It's a great pleasure and honor to be here and talk about the other main killer of us that limits our ability to live the full lifespan we deserve. It's just also unfair that many of us cannot live what we could live, the maximum lifetime, and we were being given. And cancer is now taking the lead over the cardiovascular diseases. They are head-to-head. It used to be the cardiovascular diseases, but thanks to cardiologists and innovations in that field, the mortality rate has dropped dramatically. And that's why, relatively, cancer has become the leading cause of death in many Western countries, and US and Australia. So this is the disease we have to overcome, really, as humanity, to live our whole life in healthy. And so I dedicated my last 30 years to understand the molecular mechanism, why we have cancer, and how we could find targeted therapies, personalized therapies to fight this disease. So we have to keep in mind that 1 out of 2 people in this room have a lifetime risk to be diagnosed with cancer. The good news is, just to lower the pressure, is that more than half of those will survive. Actually, the recent study published by the American Cancer Society, actually there is a 70% to survive now cancer in the US. That's amazing progress. So we are progressing, but it's still not enough, and we are still losing many of us. We also know now, based on our understanding of the mechanism of cancer, that this is really inherent, coded in our secret of life, how DNA tries to evolve and make new mutations, and this is something we want to have to stop within our body, so our cells should remain in the same state, having the same genetic background. And so this is why, by following healthy lifestyle, moving, exercise is the most important, maybe I want to highlight, 5 times half an hour, maybe that's the take-home message, that's the dose. If you want to do more sports, that's for hobby, which is what usually I say. But this is the dose that actually reduce your risk for many cancers, almost 50%. It's just amazing. We don't even understand why, the biology. But we also have to keep in mind that we can only reduce a little bit over 50%, but we cannot eliminate our risk. It's because it's inherent by the dividing cells mechanisms, and there is a risk that we develop cancer despite of oral efforts. So that's why it's so exciting to see the advances in medicine now fueled by a new modality, artificial intelligence. We talk a lot about it, but really artificial intelligence, AI, is for the good in medicine, and it introduces enormous progress again. The similar what we witnessed when we started to use molecular diagnostic methods, PCR, and now AI is the next revolution, and we all know that we can use AI to diagnose cancer earlier and smaller stage, earlier stage, and this is amazing, based on imaging and molecular pathology, and also from blood, hopefully soon. And also we have more and more therapies. Thanks to AlphaFold, now we can predict the 3D structure of a mutant gene and design new drugs in an unprecedented space. Instead of years, now within months. So we expect a new wave and tsunami of new drugs already coming. We already have 200 targeted therapies and 1,000 in clinical trials against cancer genes produced proteins. So as on one side, our ability to diagnose diseases like cancer better and better way, and we can measure more and more variables, parameters. It's amazing. We have this progress. On the other side, we have more and more treatment options, therapies. Now the problem is that the actual decision space, or the complexity or the dimensionality of what doctors have to face is growing exponentially. So we will not be able to use all this amazing information and all these treatment options if we cannot really use the right therapy for the right patient for the first time and every time. And that's I think, the next challenge. And unfortunately, when I was preparing for this conference with great joy to talk about human longevity, I was struck by a devastating news that one of our little child we were fighting with other doctors, Matthias, died last week, and I just cannot not speaking about him. He was just 2 years old. So I have been sitting in a longevity conference, and we have to think about children we lose. Really, it's really unfair because we didn't get the chance really of a full life. And he was diagnosed with a rare cancer and with a rare mutation. So, and we tried, many doctors tried to find the right targeted therapy for this cancer, and we failed for the first time, succeeded for the second time, and actually, based on our enormous advances in genomics and targeted therapies, we could give months and almost a year to this child, but we still failed to save. So that's just a reminder that cancer is inherently a biological disease, and we now understand why. By 2020, we reached the point that we can identify the genetic cause of cancer in 95% of our patients. So the challenge is that now we also know that also the number of cancer genes are countable. It's around 700. Each tumor harbors a combination of 4 or 5 driver genetic alterations. So if we choose a therapy based just by chance against one of the 5, of course, obviously, our chances to succeed is low. It's around 20%. Actually, this is the case. So this is the oncologists have to face every time now. They have a list of drugs they can choose. They have immense information in front of them, also detailed molecular profiling data, and they have to make the right decision to give the right therapy for the first time and every time. And so this is just a knowledge graph of a breast cancer patient. So if I make it closer, it's even better for you. Okay, so so this is how many connections we know based on published scientific evidence between the 5 cancer genes this woman had in her tumor. And also the positive and negative associations between potential treatments and between the genetic alterations. So that could be that there is a therapy against one gene, but that therapy is associated with another gene in the same patient that causes resistance against that therapy. So this is why it's extremely complicated to figure out which therapy to choose on a high confidence level and to make sure that all our patients receive the right therapy. Actually, there was an amazing study where the molecular profile and diagnostic test results of 50 patients have been shared with the molecular tumor board of University of Heidelberg and Berlin. And in the study, we asked the question which therapy they would recommend to these patients. And the concordance between the treatment recommendations was 44%. So they couldn't agree in 50% of cases. And of course the question is, who is right? Where should we go if we have cancer? To Berlin or Heidelberg or Austria?
And the question is, we want to have this best therapy, and we want to know who is right. And when there was a study when they compared the actual outcome of patients in precision oncology, the results varied between 0% success rate to 67%. So this is really scary. So the problem is, as we are advancing, our uncertainty is growing. And we have to, that's why I think we need a new type of medical device, and this is why we need to find a solution outside of the box. That's why a new technology can help, and this is where AI and computation comes in, because we could use now to move to the next phase of medicine, providing both personalized medicine, but also with the security and quality of evidence-based medicine. So we have to combine these two. We want to give individual therapy for every patient, but always with the highest chance that we do the right thing. When we go to our doctor, usually our doctor today explains how much % of patients responding to the drug we have who receive the same drug the doctor is recommending. But this is not what we are interested in. We are interested in the percentage of patients who receive the right drug from this doctor. Because even if this drug only works in 1% of patients, if this is me, I'm fine. So that's the concept, that we want to be sure again that our doctor gives the right therapy. And so this is what we are working on the Genomate. So we created a computational reasoning platform that it has a universal knowledge graph that has been curated, but it generates personalized, contextualized reasoning models for each patient, infinite, and then we use these models personally to generate treatment recommendations. And because this is a predictable reasoning model, we can test the performance. So now we are not testing the efficacy of a drug, we are actually measuring the performance of our ability to choose the right therapy. And based on clinical trial results, we can increase fourfold the chance that the doctor is choosing the right therapy in precision oncology, and published in Nature Partner Journal Precision Oncology. And just 2 weeks ago, we presented our real-world study at the AACR, American Institute of Cancer Research, and the late-breaking results that actually following up patients in Institute Curie, we could show that if patients receive the therapy supported by the model, actually live significantly longer. So with this, I really hope that this next technological revolution will bring us to the next phase of medicine and accelerate our progress further, and we can really reach this dream of personalized medicine which help us to find the right targeted therapy, the right medicine for all of us. Thank you very much.